Hello, everyone. My name is Carissa, and I am the Education Manager for Nursing Education and Training Australia, or NETA. Today, we will be discussing about the RN OSCE Candidate Handbook, and this is a new version that was released on the 23rd of March 2021. So let's talk about OSCE. I will be explaining what the APRA and the NMBA has indicated here, and this is based on my own understanding. And if you would have any questions about this, please feel free to contact APRA, or you can also contact us at nursingeta.com to provide you more guidance and information. So this is the candidate journey, and you can see here that you would either have a notification from APRA that you can now proceed to the OSCE. Or the Objective Structured Clinical Examination, whether you have passed your NCLEX or you have done your NCLEX in the past. So you need to get a notification from APRA that you are now okay to proceed to your OSCE. That will appear in your International Qualified Nurses and Midwifery dashboard, and you will then be asked to pay for the exam fee of 4,000 Australian dollars. Once you pay, you can also request for reasonable adjustment by sending an email to the IQNM's team, and then you can book for your preferred examination date. Then you can sit for your OSCE. And once you finish your OSCE, your result will be given to you via email 6 weeks after the test. There will be two results. Obviously, it's a pass or a fail. If you pass, you can progress to the application of your registration as a registered nurse via the dashboard. If you fail, then you need to apply for you to be able to resit your OSCE. I have highlighted a few bits here to explain this handbook. So following the completion of an NCLEX RN examination, you will then be advised by the IQNM's team that you can now proceed to the OSCE. So OSCE is a practical component. So your NCLEX was your theoretical component, which is a computer adaptive test. And after your NCLEX, then you are now able to proceed for OSCE, which is a practical examination for all internationally qualified nurses who wants to become a registered nurse in Australia. So just an overview of the RN OSCE. There are 10 stations, and these stations are skills that you need to complete and pass, and these skills are entry to practice level skills of a registered nurse. So you have to also remember that this is a regulatory OSCE, not an educational OSCE. The difference is a regulatory OSCE is more strict than an educational OSCE. So when you look at the education point of view, you are getting feedback, you're getting coaching, you're getting the prompting for you to be able to do better in the skill. However, in a regulatory OSCE, there is you will not receive any coaching, prompting, or further explanation of the task you require during and after the OSCE. So it is also very strict with the time. So an example is you will have 2 minutes of reading time. If you have not finished reading it, um, the the um, the examiner cannot wait for you. You need to proceed to the next task, which is the 8 minutes of interaction time. And these 8 minutes of interaction time would mean if you cannot finish within the 8 minutes of interaction time, you must just move to the next station. You are not allowed to speak to any candidates during your regulatory OSCE. Another thing being regulatory is that this is a very measured, valid exam. And because it's regulatory, there is some terms and agreement that a candidate need to sign prior to taking the test. And there are different terms. One would be a confidentiality agreement. There could be some videos, consent as well, and we will be discussing that later on as we go. So the OSCE will assess your ability to be able to perform a clinical skill. And it's not just a task focus OSCE, it is more of approaching the patient in a holistic manner. Say, for example, the patient may be deaf. So, how are you going to address that skill with a deaf patient? Or the patient may not be able to understand a very simple instruction, or um, there might be some physical challenges of that patient, or they might have some vision impairment. So, how are you going to address that in a holistic manner? So, we tell our students in NETA that we do approach our patient in a holistic manner, making sure it's patient centered care, and we shouldn't be task focused only, because as a registered nurse, um, and according to the NMBA standards, we are expected to provide holistic intervention to our patients. So the um, the main goal here is that you're able to perform the task in a holistic approach that is safe to the patient, and making sure that you actually demonstrate. So the key word here is demonstrate, that you demonstrate the skill, that you're actually capable to do the skill, and not just talk about what you are going to do. Um, Definitely, it would involve some talking. Definitely, it will involve some communication of what you're doing, because there are times that, as an assessor myself, there are times that I don't really know what you are doing unless you tell me. Say, for example, you're checking for the respiration, and if you are standing there doing nothing, I know that you know that you are counting the respiration, but your assessor will not know. So it is very important for you to say that I am counting the respiration in 1 full minute. And that's just an example. However, the key word here is that you demonstrate. What skills will I be assessed on? So there are some minor changes here from the previous handbook, and you can see that these skills are actually listed here. So physiological observations in our NETA OSCE classes, we are actually breaking this down into pieces because there are a lot of physiological observations. Vital signs, medication calculation, um, administration of subcutaneous and intramuscular injection, so as the whole medication administration itself. Then we have the aseptic non-touch technique, or we call this the non-touch technique. Then we have in-hospital resuscitation, safety measures such as safe disposal of sharps, wound care, hand hygiene, therapeutic patient communication and consent, infection control practices, patient identification, IV administration management, risk management in the clinical environment. So you can see that this is uh, quite broad, and in our OSCE classes, we actually specify these skills as well. Communication skills is quite important. It is not just how you're able to communicate to your patient, but also how are you able to interact with your patient where there is therapeutic relationship. You know that in national standards, or standard 2 is patient-centered care, partnering with your consumers, and you also have that in your NMBA standard of maintaining therapeutic relationships, and of course in the nurses code of conduct as well, where there is professional and therapeutic relationship. So it is very integral, and very it is not just integral, but very pertinent or important skill that APRA will be able to assess you on. This is also to check whether you include the patient's family in their care where it is necessary, and the use of your ISBAR communication tool. We do have demo classes running every Thursdays, and I know that we did some ISBAR demo class as well. Definitely, this is one that we really focus during our OSCE sessions too. You will be assessed according to the verbal, nonverbal, written, um, and your documentation as well, and how you actually build up that relationship, professional relationship with your patients. You should speak to the patient. And the reason why you have to speak to the patient is because there is some information that you actually would need from the patient for you to be able to do your interventions. Um, Asking for consent, for example, or asking when was the last time the patient has eaten food when you had to do your blood sugar levels. And these are just few examples. And in some stations, there are mannequins that you need to interact with a mannequin or to a simulated patient or actors where you really have to talk. Um, you need to you need to talk to them as you would talk to a real patient. Next is the registration for OSCE. So you need to pay the 4,000 Australian dollars for you to be able to get a confirmation, and also for you to be able to choose your test date. The exam itself will be held in 2 days, and there will be up to 4 exam sessions. That means in each day there will be 2 sessions. That will be a morning session and an afternoon session. And you are expected to attend just one session. So the maximum capacity of the exam would be 40 candidates, and that means 10 candidates per session. Um, the candidate booking selection email is when you will be asked to select the date of your preferred examination. You will be given at least 1 or 2 exam dates as well. Reasonable adjustment is quite important to those who would need it. So there would be some adjustments. Just an example, if you are, say, having type 1 diabetes and you would need to eat something in the middle of the test. So that's something that you can ask for consideration. Or if you need to have a medication at the time of your exam, that is also something that you can apply for reasonable adjustment. So how to apply? You just have to email the IQNM exams at apra.gov.au. We do have the confirmation of your exam booking. You will be then given a written notice via email that your exam has been booked. If you need to change your schedule, you need to do this within at least 3 full business days or in 72 hours. If you miss your exam appointment, you will forfeit your exam fee. However, if these are compelling reasons, APRA may consider, and we will discuss again shortly as we go through this handbook, what are the compelling reasons that APRA may consider. These are the suggested reading materials that APRA has provided. So, number one is the Australian Commission on Safety and Quality in Healthcare. So, this deals with the 8 standards of practice that each registered nurse and healthcare professionals in general in Australia are expected to follow. We do this very comprehensively during our OSCE sessions. Then we've got an Australian Medicines Handbook. This can be purchased from that link. However, we also have the Australian's Medicines Handbook that you can also utilize if you enroll with us. Then we do have Physical Examination and Assessment and Fundamentals of Nursing and Midwifery by Forbes, Watt, Hill, Hall, and Glue. Um, We do have Tollefson for the clinical psychomotor skills, assessment skills for nurses, which is also available in our library. You can lend this, we can lend this book to you as well if you enroll to our um, classes. And of course, the Australian Resource Council for your in-hospital resuscitation and your ISBAR tools, which we cover comprehensively during our OSCE sessions, therapeutic guidelines for medications, and also these, the NMBA professional standards are quite extensively discussed because these are the expectations of a registered professional such as yourself in the future. Um, these are the expectations that you have to perform. The things that you need to wear during the examination, it needs to be an appropriate clothing that is suitable for clinical practice. So just remember when you go to your clinical placement before, or if you are, going to a clinical environment for work, these would be your um, appropriate garment or appropriate clothing. You should not wear jeans, ripped or torn clothing, singlet tops, low cut tops, open toe, or high heel shoes or boots. This is for work health and safety issue and some infection and prevention control issues as well. The photographic ID that you are required to bring during your examination is either an Australian or an international passport. You'll be provided with all the equipment that you need. Pens, notebooks, notes will be provided to you. So all equipment that you would need will be supplied during the test. So no need to bring this. Personal belongings upon registration needs to be surrendered, and you will be given instructions as to how to claim this back. If you bring your family and friends, they can only go up to the reception area and they can't go anywhere else. The exam is held in Adelaide Health Simulation Center. There are two locations of the exam, and you will be the address will be highlighted to you when your test is confirmed. So again, on the examination day, you'll have 10 stations, and each station will have 10 minutes for you to be able to do your OSCE. So there is 2 minutes of reading time, and then you will have the 8 minutes of performance or interaction time. So again, the patient types would either be simulated patients or actors, and you also have mannequins or other smaller mannequins, such as the hand, for example, to be able for you to be able to use or do a procedure. Um, there are different settings, and these settings would be like an inpatient in the hospital, or in a general practice, or an aged care setting, or a community setting. The station examiners are meant to be observation only. So these examiners will be marking while you go through your OSCE. So they're not allowed to talk and not allowed to provide feedback. However, there are instances or in the task where um, the examiner needs to see your finding, or you need to present your finding. So in this case, you should address the examiner to do this. Um, It is expected that you need to perform all the tasks and necessary documentation for you to complete the entirety of the station. So talking about charts, in NETA, we have designed some charts for you, and this is also according to the standards, and also there are some examples of charts that you can see here, and which we have integrated as well in our sessions. So that is how it's going to look like. So that's how you would be able to see the mannequin, and you can have something like that as well. Or you can, there would be rooms as in GP clinics, or there could be an actor as well that will be acting out in the scenario. So any equipment that is required will be there already in the station itself. So either they will be laid down on a tray for you, or they are mounted somewhere, or they will be in a trolley. So say, for example, if you're doing a focus assessment of an ear examination, the otoscope would be located inside the room. So you can see here that that could be where, where it is. Or if you're um, asked to administer oxygen, the oxygen is already in the wall as well, that is mounted. And few other equipments probably would be in the trolley, or probably would be laid down in a tray for you. Please arrive no more than 30 minutes prior to the time that is advised, and that is where you are going to do your registration. Um, and we were talking about the terms of agreement. So you will have your um, that it would remain confidential, and that you will also get a video and audio consent form for quality assurance, for more patient training, for feedback and development of clinical scenarios, and other OSCE related materials or activities. You will have an ID card like this, where it will have your first name and your last name, and also your ID number. So you will be provided with a notebook or a paper notebook with a pen, and this is where you will be able to write down some notes during your 2 minutes of reading time. When you go inside the patient's room, you can see that you will have a blue folder that would be a patient folder. So that's where the record of the patient is, and that could be progress notes, some risk assessment charts, medication charts, vital signs, so on and so forth. Your examination circuit will be marked A to G, that would represent the 10 stations, and each candidate will be allocated your starting stations, and then you just rotate every 10 minutes. That is where your scenarios will be posted, and that will so that's where you will be doing your 2 minutes of reading time. There is a chair as well that is provided for you. um, so your 2 minutes of reading time is this is where you're going to read it. Then you go inside, you'll have your 8 minutes of interaction time. You will then be warned, or you will then hear a bell to signify that you will have 2 minutes left for your interaction time. If you're unable to complete the station in the allocated time frame, you have no choice but to move on to the next station, because 9 other candidates are waiting. If you finish the station before the completion, you are advised to stay inside the station as well. You need to leave your pen, you need to follow the invigilator, you need to attend a post examination candidate briefing after the exam, and you need to be ready to be escorted outside of the exam center. If you have some professional behaviors, it is a right of the NMBA or APRA to actually let you stop in your exam. Um, if you need any assistance, you need to raise your hand outside of the door or at the door of the station. If you're performing your test and you need some assistance, you need to inform the examiner. And assistance would mean if you're not feeling well, or you need to go to the bathroom, or something urgent, you need to tell your examiner. Your OSCE will be marked through an evidence-based assessment criteria. We do have some sample assessment tools that we use during our OSCE sessions, so the candidates will be able to get used to being assessed. So you'll be assessed during and at the conclusion of the station. So these are the tips, I think, before and during the exam during on the day is very important, but I like to highlight during the exam. So remember that you will be assessed against what is expected of you as an entry level of a registered nurse. You'll have 2 minutes of reading time, so you need to thoroughly use those times. You'll need to be prepared that it's going to be the use of mannequins, simulation patients, and part-time trainers in the examination process. Listen to all the instructions provided and avoid completing in just one task. It should be the whole scenario itself. These are the things that we said about the exemption or the compelling reasons as to why you're not able to attend the test. So it says there, how do you report an incident? And you need to report that prior to or within 7 days after your examination. You will get your result in 6 weeks' time. And what happens if you pass? You will then proceed to the registration. And if you fail, you need to book for a retake of OSCE. I think that's it. Thank you very much for listening. If you have any questions, please do not hesitate to contact us, info@nursingeta.com, or follow us in Facebook, NETA OBA. Thanks everyone for listening. Um, yeah, so bye for now.